I know that despite what you may have heard, mothers everywhere love their children, all right? You know mothers love their children, but despite that, you cannot count on them to use the medicine on their child. Now, this study, we just gave them one simple thing to do, the triamcinolone. We didn't tell them how to bathe. We didn't tell them about bleach, how to moisturize. We just gave them one thing to do, and still, they don't do it well. Another thing we learned from this study is that the timing of the return visit has a profound effect on patients' use of the medicine. If I want to get patients to use the medicine well that first week, I don't wait a month to do a return visit. Why are patients not using the medicine? Most of the focus on trying to learn why patients don't use the medicine have focused on the patients and the reasons they don't use the medicines, that they may be poorly motivated, or they may not trust their doctor, or they may be afraid of the medicine, they may be forgetful. I like to think of it a little differently. Since I don't control patients directly, I only control myself. It's kind of like a Vietnamese philosopher once said, when the lettuce is not growing well, you don't blame the lettuce. You look at what you can control. You could give the lettuce more light. You can give it more or less water or fertilizer, but you don't blame the lettuce. And when patients are not adherent, it doesn't help to blame the patients. It's only what we can control. It's not that the patients aren't motivated. The question is, did we do enough to motivate the patient? Did we act in such a way that the patient trusts us? Did we reassure them adequately about the medication? Did we build in enough reminder systems? These are all things that we can do.